Hello and welcome to Kiss My Asparagus podcast. I am your host, Latasha, and I want to welcome today's guest. I'm excited to introduce Dr. Laura Kelly, an expert in traditional Chinese medicine and a true advocate for natural health solutions. Today, we'll be discussing her unique approach to holistic wellness, including her work in personalized nutrition and how she combines modern science with ancient practices to help people thrive. So I'm going to welcome Dr. Kelly to the stage.
Hi, Latasha.
Hello. Hello. So I did a little small introduction, but if you could just tell our audience a little bit more about yourself.
Sure. Well, my approach to medicine really is to understand each person's unique function and then figure out how to address the malfunctions from a natural perspective. So there's a real combination of high tech and low tech medicine. So high tech data gathering, high tech understanding, using the tools of Western medicine from that analysis and diagnosis perspective, but then treating from a natural medicine perspective. And to me, that's really, it's really the best of both worlds, I think, in that regard.
I absolutely love that approach.
Yeah,
So you're using plant-based nutrition as well as herbs, correct?
that's right. Yep.
Okay. So can you explain how plant-based diets can support bone health? Because I've seen that you do have a book out called Healthy Bones, and plant-based nutrition is, the entirety of that book, correct?
Right. Yeah, that book came about for two reasons. I wrote a first book called The Healthy Bones Nutrition Plan and Cookbook, which I wrote for my mother and with my mother because she didn't want to take the pharmaceuticals. So we had successfully stopped and then started reversing her bone loss from understanding the diets, the traditional diets in the world and the countries that had high and low fracture rates. And so I had sort of put that information together and then given her a plan. And we successfully treated her bone density loss that way. So then we wrote a book together to allow mothers, essentially, to be able to care for their bones, because this type of medicine is done by you, right? It's not done by us. It's not a prescription that we have to write. I mean, we do give you a prescription, but it's a natural prescription, and then the work is done by you. So that book was published and internationally published, and it was an omnivore look, right? It was the way the books are set up is the first half is science and the second half is cooking, because I want people to understand why they're doing what they're doing, right? And in my practice, I find that people are much more likely to do things when they understand why. And they are also more likely to do things when it's made clear that this is their body, right? So that this personalization of information is really allowing people to go, oh, that's what I need. That's what I need. That's why I need it. And then they get better because they do what they need to do. So the books are structured that way. And then the second book, the one that just got published that you're speaking of, is the plant-based version. And this came about because there wasn't a really good guide on the market for vegans or vegetarians taking care of bones. And I saw also in my practice that people who go vegan often just don't know the basics. And this is like, you need to have certain nutrients and they just aren't available so easily, often in a plant-based diet, a strictly plant-based diet. So there are some things that you just need to know, right? And when you look at bone density from a plant-based perspective, there's a discrepancy, because the publications and literature are saying, well, most significant amount of vegans have lower bone density and things like this. But if you look at the science and the biochemistry, when you have a vegan or a plant-based eater on a strictly plant-based diet who's doing it right, they actually have better bone density and less fractures, right?
Yeah.
So the discrepancy is in the I think the discrepancy exists is when people are eating a plant-based diet and don't know or aren't getting exactly what they need. So then they end up looking with less bone density. But once you know, then you're great.
Yes.
Yeah.
Yeah. So for me, from my vantage point, I have an understanding that adding meat to your diet is going to cause the issue because of the acid and the maybe the leaching of your bones into your blood to buffer it. So I would think that a plant-based diet would be the optimal diet for bone density. No?
Yeah. Well, it is. I mean, I think that, the acid-base balance is a complicated issue, and you can certainly eat meat without a problem as long as you have other base vegetable, right? As long as you surround that with a bunch of base vegetables, then you can balance the acid in your system. So I don't think it's as strict as once you add meat, you're going to throw off the acid-base balance. But yes, generally speaking, you're going to maintain an acid-base balance. But I think that the other thing is that the plants, if they're and all of this is contingent on the plants being properly grown, right? They have to be grown in good soil. They have to be treated well. They can't have glyphosate and pesticides on them that are going to cause toxic damage to your system, right? So there are all these, qualifiers around that. But assuming that all of that's true, the complexity of the plants as a food source, you have carotenoids, you have like astaxanthin, you have all of these color chemicals. And these are flavonoids that are going to have great anti-inflammatory effect in your body, for example. And that's not even in the normal nutrient profile, right? And then they have all of these minerals, complex combinations of minerals that you're not going to get anywhere else. So these minerals are the things that the bones need. I mean, we have calcium and phosphorus that get laid down and make sort of this heavy bone. But all of the other trace minerals, 70 of them, are needed for healthy body function, healthy cellular function, and even to get the collagen that the bones, to hold the bones, to connect to each other, uses trace minerals.
So what is the best plant-based source for those trace minerals?
Seaweed.
So what seaweed do you suggest? Because I a lot of people do sea moss or like I don't know if spirulina has all of the minerals, but I do know it has like B12 maybe, right?
And it's a full protein source as well, which is really unusual in the plant kingdom.
Yeah.
So that's great. I mean, there are going to be different. So all seaweeds are great. Like if you're going to add anything, pick one and add a seaweed. Traditional Asian diets, Japanese diets, for example, they have relatively small bones, right? And a lot of times would be called osteoporotic because the bones are so small. But their fracture rates on traditional diets were nothing compared to what we have in America.
Mm-hmm.
And there's probably, multiple reasons for that. One of them is that they have seaweed in their diet regularly. So they're using something called dashi as a base of a soup, miso soup, and that's a kombu. So that's kombu, and that's ubiquitous in their diet. It's dashi is used in lots of cooking. So you're getting a lot of mineral support from a kombu. Then there's also nori.
Yeah.
So the sheets that you use to roll up sushi. And nori has an added benefit, which is that, this is a little off topic, but I think it's important. In the blood vessels, and this is talking about cardiovascular disease, which is the largest killer of women in the United States, cardiovascular disease. So this is why it's important, I think. In the side of the vessels, you have something called a glycocalyx. And this is something that I never see discussed by anybody.
I've never heard.
Yeah, it's really like, don't know why people don't talk about it. So there's a glycocalyx. And what it is have you ever touched a fish like just out of the water and it's kind of slimy?
Uh-huh.
It's that. So we have this kind of slimy, mucousy layer that's on the inside of the vessels. And that's a protectant to that vessel tissue. Okay. And it gets broken down every time we eat and has to get rebuilt. It gets broken down when your blood sugar is too high and when there's inflammation in your cardiovascular system. And it's as a protectant, the way that you get cardiovascular disease, right, is when a tiny dense LDL particle embeds in the wall of your artery, right, and starts an inflammatory process.
In addition to that, calcium too, right? Like that plaque.
So the plaque that gets built up over that is calcium-based plaque usually, right?
Yeah.
So, but the cause is this embedment of this particle in the wall. Well, if you have a healthy glycocalyx, it can't embed.
So is that mucosa? Is that what we're calling it? Is that what you're?
It's not exactly mucosa because it's not tissue in that sense. It's more like substance.
Okay.
It's like a gel layer.
Okay.
So anyway, to get back to the point, nori, particularly this type of seaweed, actually helps rebuild that gel layer. So it's a really good seaweed to introduce if you have any cardiovascular risk. And it's just good anyway for everybody, basically, because blood sugar is so high in the United States, it's always going to be breaking down this glycocalyx, which opens you up to cardiovascular, disease.
Yeah.
So
interesting. Okay. So since we've been talking about, Asian food, in your practice, how do you balance traditional medicine with modern precision medicine? Exactly. I know you kind of got into that and explained it a little bit, but
yeah,
it's basically just drawing the lab work and diagnosing through traditional Western means, and then, like you said, actually treat with Eastern approaches.
Yeah. I mean, when I started doing this, what I treated my mother, we got results, and then the book came out, and then a bunch of people showed up and said, my practice became about, can you do for me what you did for your mother, right? And I'm a science-minded scientist person at heart, right? And I didn't want to just tell people, well, here's a list of supplements, good luck, right? That's just not medicine, right? So I looked around for a couple of tools to use to be able to help understand the body in which I'm trying to operate. And this is an interesting, sort of point, which is that in traditional medicines, you don't just treat the disease. In traditional medical diagnosis, like a Chinese medical diagnosis, you understand the disease, but you also understand the body in which that disease is happening. Mm-hmm. And you treat based on both of those things. You don't only treat based on, okay, you have a cough, take this, right? Mm-hmm. You're going to treat differently based on the person.
Yeah.
So this is a concept that I always prized very much. And in conventional medicine, that wasn't the case for a long time until the advent of what's called precision medicine. So precision medicine started as this concept maybe 20 years ago of applying the genetics of the person to treatment decisions. And that enabled doctors, to start understanding the body in which this disease was occurring. So it was like this concept that was an old traditional concept was now starting to appear in conventional modern medicine. Mm-hmm. And that's great, right? It's great that that medicine is moving towards a paradigm of personalization, because what they found was that pharmaceuticals work in some people and don't work in other people. And pharmaceuticals will be given to somebody and they will have a negative reaction.
Yeah, because pharmaceuticals are targeting a specific symptom or a specific, system in the body, not considering, like you said, the full body. So then there are side effects to those medications because of the fact that that's not a whole compound. That's not a whole organic compound. It's been spliced up for somebody else's benefit and not the person that's receiving it, honestly.
Yeah.
When it comes to illness, and I did want to ask you about this when it comes to genetics. Like, that is wonderful that precision medicine is focusing more on the individual and the genetic aspect of things. But I do want to ask you just about I know we're all genetically different, but
Yep.
the fact that we're all human beings and there is like an original genome that we all come from, I just would think that if we all got back to that natural approach in general, it would benefit us all.
Yes. Well, you're absolutely right. It would benefit us all, which is why I'm such a huge proponent of it. But you have to remember that even though we're all kind of the same and we have the same genes, genes are not hard. Genes are hard coded. Like here's your gene, but they can be on or they can be off.
Yeah.
And this is the difference, right? That's called epigenetics, right? So that is when you have, say, you have there are studies of twins, right? They have exactly the same genes, but one of them gets sick and one of them stays healthy. And the difference is the epigenetic effects. The genes are the same, but they have different genes that are on and off. And so what that's doing is it's telling the body, produce good things, produce bad things. Don't function this way, do function this way. And that is based almost entirely on diet and exercise
Yeah.
and
I'm a twin,
breathing.
actually, which is interesting that you mentioned, but we're fraternal actually. But
Oh, right. Oh, okay, cool.
yeah, okay. So
So even though we are the same genetically, and yes, we all need to get back to the natural products because this is how our bodies were formed,
yeah,
and we are part of that natural world, and we function better when we are in harmony with that in dietarily as well.
mhm,
Um, it is true that by nature of how we're formed, which is when you have a sperm and an egg, and there's their chromosomes and genes are coming together, it's a random mixture. There's no pattern to it, right? The system goes blah, 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 right, and then we come out. So we can get any combination, and we can get any pattern, and we can get genes that sort of function, and we can get genes that don't function. And then in our lifestyle choices, we can change that
yeah,
and get more genes that don't function, right? So these are the things that you need to know about yourself because this happens in nutrition, right? So if you eat vitamin B6 in something, your body is not going to use it in that form. Your body is going to transform it into something called pyridoxal 5 phosphate, P5P. In order to make that transformation, and it has to, because your brain will use P5P, not B6.
mhm,
So, in order to make that transformation, that requires genetics. And anytime you have a gene, you have the opportunity for it to work, partially work, or not work. So this is information that's very basic to fundamental function, right? So we are all the same, but we're going to have these differences. And these are the types of differences that greatly impact physical function. So the more you can understand about your own genetics for nutrition, which is something that I do as well, this is part of the look at the body. Then you can say, okay, well, I am never going to make the transformation to P5P because that gene isn't working. So I'm going to take P5P, not B6, right? So then you have the functioning form and your brain works well, and now your attention span is good. So those are the really sort of key little things about genetics and nutrition that weren't looked at in conventional medicine because they don't have any nutritional medicine, right? So
yeah,
when I'm saying, how am I going to treat this body?
mhm,
This is some of the data I need to know because I need to know if you're not making P5P, then your brain's not going to work well, right? As an example. So this is sort of how I'm combining. I'm looking at the mechanisms of action in your body and saying, what do we need to do to make those work for you?
gotcha. Okay, so with all that being said, to me, I think it gets overcomplicated, and it could be simplified with just plant-based approaches and our genes affinity for those plants that are in their natural form without the, like you said, genetic modification, hybridization. All of our genes, like we mentioned, have an affinity to these natural compounds. So
Sure.
to me, it's like, it can get complicated. And I think sometimes that's where medicine goes, in this direction that is farther and farther away from the origination of our vitality. You know what I'm saying?
Yeah, sure. I mean, the fact is that the mechanisms of the body function beautifully when they have the basic nutrition that they get
Yeah.
from a good diet. And it's a step beyond to say, well, can we make a synthetic substance to then go back and try and affect function when you have the availability of something that's actually going to function perfectly, right?
Yeah.
If you can figure it out. So that is true. But I mean, I will again highlight, just to be clear, that in a vegan diet, for example, we are animals, right? So we use a form of vitamin A called retinol, and that's the form our body uses. Plant-based retinol is called carotenoids because it's not the same molecule. So when you are on a plant-only diet, you're eating carotenoids, and your body has to transform those carotenoids into retinol for your body to use it. When you have genes that don't function for that transformation, you can eat all the plant-based carotenoids you want, but you will not get retinol, and then your body will not be able to function because it won't have vitamin A. So even when you're totally plant-focused, there are still potential obstacles because of genetics. And that's the basics of understanding. I mean, I see quite often this happening, is that people are not able to transform. This is not uncommon, because the transformation of carotenoids to retinol can be up to 24-1. So you would have to eat 24 times the amount that you would have to eat if you were eating an animal-based retinol. So there's a huge lag. And this is just one of those basics of understanding about yourself so that you can fully optimally use the plant-based diet.
Okay, so I assume you get into that in your book in detail.
Yes, I do.
Okay. And I wish I had a chance to read more, but I wanted to get you on the show so fast I didn't even get a chance to. But I did want to ask another question that's kind of in a different direction. Can you talk about your experience founding the OCO and your company focused on women's sexual health?
Sure. Just as a note, we're changing that company to, it's called now Inner Beauty Science and Technology, and the line is called In Beauty now. I liked it much better than OCO, so it's now In Beauty. And that's sort of the ethos for that company is really in beauty, right? I mean, as we age, women are like told that they become invisible. Women are told that they're no longer attractive. There's a whole like wasteland that you're supposed to step into as you age as a woman, right? And it's totally BS. So there's, I mean, 2% of physicians, this is a Medscape poll, and Medscape is for doctors. 2% of physicians feel comfortable talking to their patients about menopause. 2%, which leaves 98% of physicians like, I don't know what to say to that woman. Right? Yeah. So there's this huge gap in not only medical care, medical understanding. Women were left out of, research. So who knows if the research applies to so there's this whole gap in women's care, but especially older women's care, midlife women's care. So what I saw from the patient population who were losing bone was that the hormone issue is an issue, right? Because that's related to bone loss. And the quiet stuff that came up in conversation, I wasn't there yet, but having these conversations, there was pain when they would try and have sex. There was pain just from existence in, the vaginal area. There was leakage, right? Just from the tissue of the urethra becoming thin and just leaking. And no solutions to this, right? They would go to their doctor and the doctor would be like, welcome to midlife, right? Which is not an answer, right? That's not a solution. So I started looking into how, so a lot of women are told by their physicians, well, take DHEA because it's over the counter. And DHEA is a hormone precursor. So it's made in the adrenal glands and in the reproductive tract when you're active, making hormones. And it's a hormone precursor for the sex hormones. So there's this kind of general, like, physician's guidance of take DHEA and maybe it'll help, right? So I saw a lot of women who were taking oral over-the-counter DHEA, but it wasn't helping their vaginal symptoms at all. And so I tried to figure out why it really wasn't helping. And the reason it wasn't helping is because DHEA is actually metabolized in the skin. So I said, well, okay, so why don't we put it on the skin? Why don't we just put it on right on the vulva and see what happens? So I had some very willing friends and I said, can you try this? And they tried it and it worked wonders because you're actually generating the DHEA in that local tissue is generating testosterone, not estrogen. So it's safe for everybody and it revitalizes that tissue.
Okay.
And one of the reasons it revitalizes that tissue is because there's a big chunk of the vulva, a lot of tissue of the vulva, which is called the vestibula, the vestibular tissue. And that tissue is actually bladder tissue. And it needs testosterone to be healthy, not estrogen only. So when you don't, it's so much tissue that when you don't have any testosterone present in that tissue, it dries out. And it gives you the feeling of having a UTI, but you don't have a UTI. So much of the UTIs of midlife women are misdiagnosed as a bacterial infection because that's the only diagnosis there is, when in fact, it's just this vestibular tissue not having testosterone. So when you use this product, it revitalizes that tissue and it brings back wetness, you don't have pain anymore, right? So then the relationships, which was really my goal here, the relationships of these women not being able to be intimate with their husbands or their partners was devastating, right? And so bringing products like this to market enable the reconnection of the people in that intimacy, in their relationship, and changing their life experience back to something feeling whole in themselves.
Awesome. I love that. So I did want to talk about vitamin D and how our genetics affect us utilizing that vitamin and it being utilized as a hormone, et cetera. Can you talk about that a little bit?
Sure. I mean, as you just said, vitamin D is an essential nutrient, and there's a lot of discussion in the literature. Well, it's not important. Who cares? Don't test it. It's crazy. It's involved in thousands of processes. As you know, in its final transformation, it actually interacts with the genome. It is a tumor suppressor. It sends cancer cycles into cell cycle arrest. Like, it has huge amounts of effect on the system. It's required, everybody probably know, many people probably know it's required for you to absorb calcium from your intestines. So this is a really big issue for bone density. So there are 4 major genetic transformations for vitamin D. And again, you have to be able to make sure that all of those genes are working, because if they're not, then you don't make the transformations properly. And then you don't end up with the forms. So the vitamin D that's measured in your lab testing at your doctor every year is the storage form of vitamin D. It's not the active form of vitamin D. And so and this is kind of a point, I actually have a patient right now where we're dealing with this, which is that her kidneys are not functioning well. And what this means is that she will not be transforming the storage form into the active form, because the kidneys is the place of that transformation. So if you have kidney disease, which is an epidemic in the United States as well, you're going to have impaired vitamin D transformation because your kidneys don't function. So this is a big issue around kidney disease. So that's going to require not only the genes to work, but also the kidneys to be functioning well enough to get that active form of vitamin D.
So how do we
Um,
restore that kidney function?
That's a good question. If you can figure that out, then you're going to have a really successful company.
I
Um,
mean, I know that there are ways of doing that.
There are ways. So first of all, obviously, a lot of the kidney testing that's done, people are dehydrated. So dehydration is a huge factor in kidney function, right? You've got to just be hydrated. It's super basic.
Mm-hmm.
The other way of going about this is there are traditional herbs that will restore kidney function. So in Chinese medicine, there's an herb called cordyceps and another one called huang qi, which is an astragalus.
Great mushroom. I have that in my coffee in the morning. Well,
Perfect.
it's not actual coffee. It doesn't have any caffeine. It's just mushroom. Yeah.
Oh, nice. Great. Yeah. So these herbs are going to uh, restore kidney function to, I mean, we're not talking about going from a GFR of like 20 to 100. We're not talking about full restoration. But what we're talking about is over time being able to bring back that filtration enough to pull you out of the danger zone, right? From a medical perspective, it takes time. And that's why it's such a difficult thing to do, because you have to be compliant and take these herbs every day for a year. If you do that, you will return some function.
And if your diet is one that is not causing too much stress on, I call it the mucosa. You call it something else. But and I can't remember what you said. But I mean, if your diet is that, more plant-based, more kind to the, organs in your body, kidney included, I'm sure you can restore that kidney function with, some herbs. And also, I mean, that pH balance that we're talking about, that's what the kidney is pretty much in charge of, in addition to, I guess.
Yeah, absolutely. Absolutely.
So it's like, if we get that restored, I don't know how we couldn't get the kidneys going back too. I mean, to me, it's just, it seems simpler than it is presented. And it's like, yes, there's a whole system that we have in our bodies, and it works beyond our comprehension. And
Absolutely.
it's like, to me, we have to start to think more about what we don't know versus what we know.
Yeah.
I think that's something that we need to kind of shift our attention to. But that's just me.
I agree with you. I mean, this is a perfect example. I mean, this patient who I'm working with, who's in the hospital now, who's having really bad kidney function and therefore not producing the active form of vitamin D. So her body is breaking down her bones in order to put the right calcium in her blood to keep that pH balance, right? The approach from the hospital, from the doctors, who are wonderful, is that, what are we going to do? Why even bother to treat her? Right. And it's the opposite of what it should be, right?
Yeah.
Because what it should be is, we're going to do everything that and you are going to do everything to see if we can bring this person back to health.
Mm-hmm.
That should be the answer. That should be the response.
Yeah.
But the system is so disease faced that it's like, oh, she's sick and whatever. We're not going to be able to fix it.
But
And
it's not, yeah, and it's not helpful that we're putting more acidic chemicals into the body on top of the kidney function being debilitated. It's not helpful. So, yes, the system is not rigged in our favor. And to have a provider like yourself is a godsend. So, I mean, I love what you're doing.
Appreciate that.
I love what you're doing. But, I do want to ask, what advice would you give someone who's just beginning their journey toward, plant-based? Because, we're at Kiss My Asparagus, that's what our focus is plant-based medicine, and diet. So
Yep.
what advice would you give somebody just starting that has no idea about this stuff?
I would say start right from the beginning, like do it right away. That's the best advice I can give. You know, whether it's my book or somebody else's book or wherever the information is, you can't get around the fact that you're not going to barely have any B12 in your diet, right? You just can't get around that. The protein consumption is really different if you're eating meat, which is a complete protein, right? You don't have to worry about it, or whether you're consuming plant protein. Then you have to make sure you have the right combination of things to make sure you have a complete protein, right? Rice and beans, right? There are a lot of combinations that will give you a complete protein. These are things that you just learn, become aware of, figure out the patterns of things that work for you. And then
I mean, there are a lot of complete proteins that you can get. And it's sad that, I don't know, you can get complete protein easily in a plant-based diet, as you
yes,
know.
But you have to know. But you have to know that,
yeah,
right?
That's true.
And you have to say, I only eat Mexican food. I only eat rice and beans. And I'm just going to eat the beans or whatever, right? I'm just saying that you have to be aware of yes, you can totally get complete protein from plants, but you have to be aware of where they are, and you have to make sure that you have them in your diet. Now, the other thing to mention about that is that there's everything has little nuances, right? So even though spirulina has a complete protein, there are different levels. Huh?
And B12 too, correct?
Say again?
And B12 too, correct?
Yes, correct.
Yeah.
That's a great plant-based, food to add.
Yeah.
But with protein, so proteins are made up of amino acids. Yeah. And each meat protein, like flesh protein, has all of the balance of amino acids that we need because we are also animal, right? Mm-hmm. So when you're looking at plant proteins, even though they're complete, they have lower levels of some of the major amino acids that we need. So it really does behoove people to come to understand protein sources as a plant-based eater, just for basic general knowledge, so you can be really smart about managing your health.
Yeah, and I think that is important for people to understand. But I did want to ask you about like the elements like nitrogen, being the building blocks of muscle, enzymes, etc., and focusing attention on the nitrogen-based structures. Could you talk more about that? Because that's new information for me. And understanding that, and understanding protein, and understanding the fact that nitrogen is the element of plants in the first place. Could you talk about that to give us some understanding or insight?
Honestly, Latasha, I can't really. I mean, I know that. So when you're growing plants, you want to have a nitrogenous, environment. Mm-hmm. So you're gonna get healthy plant growth from a nitrogen-rich soil. So the way that's going to function is the plants are just like us, right? The plants have to have the right kind of environment and nutrition so that they can have the right nutrition for us, right? Mm-hmm. So it's that nitrogenous cycle starts with whether you have healthy plant soil and nitrogen-based soil to build the proper plant structure or you don't, right? And if you don't have a rich nitrogenous environment, then maybe your plant isn't as good or healthy or good for you as it was before. That's about the extent of my knowledge around that.
Okay.
I would love to know what you were.
So I have a doctor that I follow who I believe has some vast knowledge about healing. Mm-hmm. And I've been following him for a while, and he talks more about nitrogen and the nitrogen-based structures in the body, like I mentioned, the muscles and the enzymes, and those actually being the element that we should focus on rather than the actual protein. Mm. And that's something that I can't speak on in detail myself because I'm still doing research about it, but I wanted to get your approach if you had an opinion about it. But
no, I don't. I mean, I'll look into it.
Obviously, it's new to me.
Well, I mean, I understand that, but I also protein is absolutely required, right? A complete protein is required. DNA has one job, to make proteins. Proteins are enzymes, proteins are skin, proteins are every organ layer, right? So when on a daily basis, if you eat, for example, hot, spicy food, you're going to tear, some of the skin in your esophagus is going to be like a little bit damaged, right? You're going to go to sleep. Let's assume that you get at least an hour of deep sleep. Your body's going to go through a repair process where it's going to repair all of that tissue that you've damaged. If you're an athlete and you're running, you're going to microfracture your bones. You're going to repair that during deep sleep. You're going to use protein to do that. So if you don't have it, you're not going to do a successful job at repairing your system over time. And this is one of the things that you see as people age, where they don't actually eat enough protein, and then they don't do a good repair job over time. And what they're seeing in research now is that actually the older people who are eating more protein have a longer lifespan because of this repair process is actually able to happen. So I don't think it's right to say don't focus on protein. I'm sure that nitrogen is really important, but I think it's also important to focus on protein.
Okay, gotcha. So, you study Chinese medicine.
Yes.
Have you read the China study?
Yes.
So can we talk about that and the perspective of the doctor that wrote that book on protein?
Yeah. You start. I don't know. There's a lot of information. So
well, it is a lot of information. Just as far as I can remember about the study was he in Okinawa? No, he wasn't in Okinawa. He was in China. I can't remember exactly where. But basically, he followed some people for a long time and studied the areas and how much protein they took in. And he noticed that they were getting certain cancers in the areas that they were consuming more protein. Mm-hmm. That's basically the gist of it, of the China study. Right. Is that when they were consuming a bunch of protein, they would develop certain types of diseases, certain types of cancers versus other areas. Right. But yeah, I read that book, I don't know, a few years ago. So I'm giving you a summary that's a little shot.
Yeah.
But so if you read it, correct?
Yeah. So this is really great way of speaking about the balance that has to happen in the body, in the world, in everything. There is a balance, and this is the hardest part of life, right? Is finding balance, right? Everywhere, in everything, but also in your protein. Because you need to have enough protein to be able to repair all of your systems and build all your enzymes and et cetera, et cetera. However, protein triggers something in the body, which is called IGF-1. And this is insulin-like growth factor. And it is a molecule that will trigger something called mTOR. So this is how you get muscle growth, but it's also how you build tumors. So it's a pro-cancer state that you put your body in when you consume protein. Mm-hmm. So how, this is one of the reasons why we don't live forever, right? Because there are these things which we have to balance, which we're never going to be able to fully get rid of. We're never going to get rid of going into mTOR. We have to do that because we need the protein to build our bodies.
So going back to a fully plant-based diet makes more sense then. Because if you're consuming a bunch of, meat protein versus the protein that you would get from a vegetable, fully plants would make more sense because you're getting less of those complete proteins. We're eating more protein than we need.
Well, you're right. But so what it looks like is that even if you're eating the same, complete protein from a meat source or from a plant source, there's more IGF-1 stimulation from meat than from the plant source protein.
Gotcha. Okay.
So you're still going to get some IGF stimulation from the plants. Mm-hmm. And I don't think that this science is totally done yet, But what it looks like now is that there's much more stimulation of the negative effects of IGF-1 from meat versus a plant protein. So that's a key reason, right, to move to a plant-based diet right there.
Yeah, for sure. Yeah, that book definitely changed my perspective, and a few others. And I definitely am gonna read your two. Like,
Great.
So what are some challenges that you feel people face when they're trying to maintain bone density? And what demographic do you usually see? I mean, I know it's more women.
Yeah, it's mostly women who are coming in. And the demographic really is, I mean, so in conventional landscape of insurance, you're supposed to get a bone density scan at age 65. That's
Okay.
when it's paid for by Medicare. By that time, you've already not had estrogen for 10 plus years, right? You've had the opportunity to lose your bone density, and you've lost muscle mass, right? So your insulin sensitive, like there's all kinds of things that have already gone wrong, right? By age 65. So by the time they do the scans at 65, most women, a lot of women come back with bone loss, right? But what I'm seeing is that women are now starting to proactively do those screenings earlier. So my patient base is starting at around 50, 52, and then moving up into about age 70, maybe 70 plus,
Okay.
75. And that's where we're seeing the bone density in the 50s, right? We're not seeing it starting in the 60s.
Oh wow. Okay.
Yeah.
All right. So what are your future plans? Like, do you have any other projects in the works? Like, what do you have going on?
Yeah, well, so that company in beauty that I'm making products in is only sort of half of what I'm doing, right? What I realized, again, out of trying to do this work with women, with nutrition and natural medicine, was that their doctors, because they're not trained in natural medicine, would not order nutrition testing. And the genetics that I use for bone density and for nutrition uh, are not available to the general public, right? Because their doctor only orders. It's out of a lab at Stanford University. Nobody really knows about it, right? So access to the testing that you need, that I need, that everybody needs in order to understand their basic nutritional function so that they can stay healthy is not being done for these people. It's not being done for anyone. So I built a platform, which is called My Opal, to enable people to go to the platform and order this testing because they couldn't get it any other way. So that platform is a platform that I am providing for essentially women. I mean, it could be for men too, but I'm sort of focused on women right now, to be able to order the nutrition testing and the genetic testing to understand their own bodies so that they can make the right decisions. Because everybody's going to Google and saying, what supplements should I take? I'll take these 10 things, right? And we don't have to guess. We can look and we can know what you need. So you can get those, once you know what your body needs, you stop spending all that extra money on supplements. Most of it you can do through food. Most of it you can do through, plant-based food. And there are a few things that maybe you need to supplement if the levels are very low. But here's the data for you to be able to really make a strong foundation for yourself from nutrition. So that platform I built, and it's available for people to use. And I'm expanding that platform to cover the issues that really, target women the most. Like I said, cardiovascular disease is the thing that kills the most women in the United States. So cardiovascular disease, like all of the metabolic conditions that we see in the developed world, are not diseases, they're deficiencies. They're metabolic deficiencies. So that's why I'm able to reverse osteoporosis with nutrition and natural medicine, because it's a metabolic problem, not a disease. The same thing is true of most of type 2 diabetes. The same thing is true of a majority of heart disease, right? And the same thing.
It sounds like cancer.
And at least it was published, a month ago, that at least 1/3 of cancers can be prevented through proper metabolic, understanding.
Mm-hmm.
So that means that at least a third of cancers are also a metabolic problem, which can be prevented.
Mm-hmm.
So these are all things, the American Heart Association said up to 90% or 80% of cardiovascular disease could be prevented. That's the American Heart Association, right? That's not me. So all of this work could be done, right? And all of this disease and misery and suffering and expense could be prevented. So, and not to mention all of the cognitive stuff that could also be prevented, right? I mean, the Lancet, which is a very, very esteemed British, medical journal, 2 weeks ago published that at least 50% of dementia could be prevented through diet.
Yeah.
I mean, it's like, okay, so then let's do it, right? So the platform that I have that I'm building out now is built to address all of this and to help people be proactive from a nutritional and natural medicine standpoint to prevent or reverse these issues. And we've already working with this lab at Stanford, this data, we've already proven out reversal of osteoporosis from a natural and nutritional standpoint. And we have 10 times the bone density of the drug from a natural medicine standpoint.
Mm-hmm.
It's just more effective
to
use nutritional medicine if you're doing it right.
Yeah.
So this is medicine that everybody can do. And that's what I love about it. Everybody can do this.
Absolutely.
Most people can reverse a metabolic chronic disease by themselves if they have this information.
Yeah. And that's why platforms like yours and us at Kiss My Asparagus is so important, because I definitely want people to get the information that they need so they can empower themselves.
Exactly.
To, have longevity and vitality. Like, that is a human right. And I think people are not getting the information that they need to, like you said, make an educated decision about their own health.
Yeah.
So, that's my mission. I love that you're on the same mission with me.
Yes, absolutely.
If you could tell our audience where they can find you. I have it on the ticker at the bottom, but if you could tell them,
sure,
sites and your social media.
Absolutely. I just want to say one thing in closing that's like so vital.
Yeah.
The healthcare system in America is a business. So you are a healthcare consumer.
Mm-hmm.
If you're going to consume anything, you are going to say, what's the right thing for me right now? You're not just going to take whatever you're told to take. So please consider that healthcare is a business and you are a consumer. If 70% of United States people in the United States are sick from that system, it's great if you're in a car accident and you need to go to the hospital. You want to choose as a consumer conventional medicine. But as a consumer, if you want to choose wellness, maybe you want to look around and consume a different medicine, because that structure is not going to keep you well.
Dr. Kelly, you over here preaching today. And I love it. I love it. Absolutely. Thank you for putting it that way, because honestly, of course, I know it's a business, but to look at it from the consumer perspective, absolutely. We need to start seeing other businesses. We need to take our business elsewhere.
Yes, you can take your business elsewhere if that's not keeping you well, which it isn't. So it's just it's food for thought. So yeah, I have a private practice. It's Laura@drlaurakelly.com. My platform for helping now, it's geared towards women reversing osteoporosis with data and natural medicine, is myopal.com. And my women's wellness business and products are currently at oco-health.com.
All right.
And call me for anything you need.
Thank you so much for being on the show today, Dr. Kelly. You have been a pleasure and a wealth of knowledge for our audience. I really appreciate you being here with us today. And signing off, this is your host, Latasha, and this is Kiss My Asparagus podcast. Please like, share, and subscribe so you can receive alerts about our new episodes. And until next time.